Hi, welcome to the CPIC Resources for Services, Cognitive Behavioral Therapy. This is our third session. Thank you for joining us. Today, what we're going to do is go over forms and tools that will be helpful for administering the BRIGHT CBT program we discussed on the second session. These forms and tools will also help with initial setup with new clients, assessing progress throughout treatment, relapse prevention, as well as follow-up. A quick overview of what we're going to be doing today. First, we're going to be looking at the CBT Therapist Toolkit forms, and we'll learn how to set up the study and registry record. We're going to talk about how to assess and address barriers to therapy, cultural considerations, suggested protocol for assessing progress for a client during sessions, and relapse prevention and follow-up for your clients. So here on the screen, I have a list of all of the forms that are available online on the CBT Therapist Toolkit. These forms are available on the website for CPIC, which is the communitypartnersincare.org website, and you can download all of these forms there. We will be going over these forms in more detail, but here they are all in one list. There are forms for documentation and information gathering that include an initial contact worksheet, contact information in the client register. There are treatment-related therapist forms, such as Getting to Know You worksheet, the PHQ-9, which we've discussed both on the first and the second session of these CBT trainings. There's the PHQ Register Follow-up, the PHQ Graph, the Post-Initial Visit Evaluation, CBT Session Records, and Communication Form. Finally, there are some treatment forms and information for clients, such as their personal treatment plan, their personal wellness plan, a relapse plan, and an example of a safety contract. I wanted to spend some time to talk about the first visit. A typical first visit in the CPIC program, the client will most likely be referred to you for assessment and or treatment via his or her case manager. This case manager may have already had initial contact with the client and have already been pre-screened for depression, assessed for their major stressors, resources, and clinical needs. They may also have been briefly educated about depression and its care. In other cases, you may be the first person to make contact with the client, so if the client doesn't have an assigned case manager, or if you are both the case manager or the therapist for the client. Before the first session, we would recommend that you set up the study and registry record. So how do you set up the study record? You set it up with the following forms that are available in the Therapist Toolkit. There's the Contact Information Initial Telephone Call Notes form, which is Form A. There's the Initial Visit Worksheet, which is Form B. The Getting to Know You worksheet, which is Form C, Post-Initial Visit Evaluation, also known as Form D, the Individual Patient PHQ-9 Progress Graph, which is Form E, the CBT Session Record, Form F, and my Personal Treatment Plan, as well as my Personal Wellness Plan. These are Forms G and H. So to talk a little bit more about the study record, if the client has been pre-screened by his or her case manager, Forms A to D may already be completed by the case manager. So Forms A, B, and D are completed by the case manager, and Form C should have been completed by the client. If this is the case, be sure to obtain the completed forms from the case manager to put in your files. If the client has not been pre-screened and or you are the client's first contact, then you have to fill out Forms A, B, and D and ask the client to fill out Form C. So let's take a look at some of these forms now. Form A is the Therapist Contact Information and Initial Visit form. This form is a one-page form that gives you some information, basic information about the client, their phone number, best time to reach them, their preferred language, who their primary care provider is, and who their care manager is. And there's also a space here for your telephone call notes. When you're calling the client to schedule your first session or to do a brief intake on the phone, you can put your notes here. And all of this is in a very compact one-page form. This is Form A. Again, this is the Therapist Contact Information Initial Visit and Telephone Call Notes form. Form B is the Initial Visit Worksheet. This is the worksheet that you may use to guide your first intake interview when the client comes in person. This form also is a very, very short form. It's also one page, and it gives you a space to write down all the pertinent information that you would come up with during an intake. You can also use this form to guide your interview. So for example, the first part of it has symptom checklists. The symptom checklist has most of the prominent symptoms that you would see in a client who might be depressed. And then there's a space for other indicators for depression. And on this page, there is a place where you can put the PHQ-9 score. We'll talk about the PHQ-9 a little bit later in the session. And then there's a space to fill out your treatment history for this client. So has the patient been treated for depression in the past? And what type of treatment does the patient want? And what type of treatment is the patient opposed to? Then there's a section for current medications. Are there medications that the client is currently on, whether it's for physical problems or mental health problems? And finally, there is a section for a social situation. What's the client's current stressors, and what are their sources of social support? So again, this is Form B, the initial visit worksheet. Form C is the Getting to Know You worksheet. Now this is filled out by the client. You can give this form to the client when they first come to therapy and have them take about 20 minutes or so to fill this out. So on this worksheet, the client talks about activities they like to do, their experiences with treatment, things that would make it hard for them to get care. So these are the barriers to care that the client is self-endorsing. Some indicators of whether or not they're having any current alcohol or drug issues. A space to put down the medications they're taking. Significant events that they've experienced in this past year, and it's a checklist, so they can write down something, or they can just check from the checklist. And then there's also a space that gives them a chance to put questions down for their provider. So sometimes clients have a hard time saying face-to-face what are the things that they need, and giving them a space to put it on this worksheet can sometimes help elicit that. So this is Form C, the Getting to Know You worksheet, and this form is filled out by the client. And now let's look at Form D. This is the post-initial visit evaluation. And this is the evaluation form that you fill out, a one-page evaluation form once the client leaves their first session. So on this form, there's a place to write down the patient's therapist, primary care provider, and care manager, including their contact information. And then there's a place where you can rate the depression phase of this current client at the time of the post-initial visit evaluation. And finally, there's a space for referrals. Are there any referrals that you're making to the primary care provider, psychiatrist, care manager, or other providers or resources? And then there's a place to also document the treatment plan that you're thinking of starting to do with this client, as well as a space to write down the next therapy follow-up appointment for this client. So just to reiterate some facts about the Getting to Know You worksheet, this is a really helpful worksheet to guide the assessment interview. This worksheet asks about the client's strengths, resources, depression experience, stressors, treatment experience, barriers to care, and prompts the client to think about questions for their providers. If the client has completed this with a care manager, it'll be very helpful for you to obtain a copy of this worksheet before your first interview. Let's move on to some of these other forms. The CBT session record, which is Form F, will be used for note-keeping during the CBT treatment. You're going to fill out one of these forms for each CBT therapy session. The treatment plan, which is Form G, as well as the wellness plan, Form H, is going to be filled out by the clients with your guidance after the completion of the 5-steps assessment process discussed on our first RS-CBT call. This is used to clearly communicate with the client his or her treatment plan and other helpful wellness resources. After completing this form, you'll provide one copy for the client and also keep one copy for yourself to keep in the client's study records. So let's look at these forms, E, F, G, and H. So Form E is the individual patient PHQ-9 progress graph. Now we're going to go into the PHQ-9 in a little bit of detail later in this session, but I just wanted to show you what this progress graph looks like. The progress graph has space for 12 sessions. This is exactly the number of recommended sessions for the Bright CBT program. And in each session, you can mark what the client has scored on his PHQ. The PHQ-9 is scored on a dimension of 0 to 4 means none to minimal depression, 5 to 9 is mild depression, 10 to 14 is moderate depression, 15 to 19 is moderate to severe depression, and 20 to 27 is severe. This is a good way for the client to keep track of how their depression is progressing throughout the treatment as well, and to show them where the spikes and the peaks are and where the valleys are, so they can be a little bit more attuned to the events that are happening that might be triggering their depression responses.